Well, most of us experience stomach or intestinal discomfort at some point in our life, and the cause could be as simple as eating something that didn't agree with you, or serious digestive issues that may require medication or surgery. Joining me to discuss options for stomach troubles is Rob Montagnes, the president and CEO of Licking Memorial Hospital, and Dr. Shakil Karim, who specializes in gastro diseases at Licking Memorial. Gentlemen, nice to have you both here.
Good morning.
Having us.
Rob, we talk about Licking Memorial as a smaller community hospital, and yet you have all kinds of specialty services like what we're going to talk about today. Why is that important in a smaller community that you offer these specialties?
Well, we've been very fortunate to attract top-notch physicians like Dr. Karim, and we're going to hear today about some of the technologies we make available, and when we marry those two, we are able to take care of our community close to home so they can receive services, very high-tech services, within just a few miles of where they live. And we're very proud to offer that in our community.
And why is it important for the patient's health, to be able to have something close to home?
Well, I think clearly, especially what we're going to talk about today, when there are so many obstacles or barriers for folks who don't want to have that screening colonoscopy, any excuse perhaps, the long distance, the inconvenience with travel or getting my family member there, those are taken out of the equation, and they can have that service within just a few minutes of where they live and get hopefully great results.
And fewer the excuses, yeah.
Absolutely.
Dr. Karim, gastroenterology is your specialty. It's a broad term. So what kind of problems are we discussing?
Well, gastroenterology constitutes your entire esophagus, your stomach, small bowel, colon, as well as your liver and your pancreas. So, so the symptoms could be variable. I mean, from difficulty swallowing to weight loss and change in bowel habits, for instance, or significant amount of blood in your stool, which may not be just some symptoms that are related to indigestion, or perhaps, I just ate something wrong, but they could actually be related to something very serious, such as colorectal malignancy or esophageal cancer.
So those are signs that people should take seriously, maybe what they're finding out is not quite right with their body. And then you can help those folks at Licking Memorial?
Absolutely, absolutely. A quick background is that I was trained in Chicago, so when I came out to Licking Memorial Hospital for the first time, I saw it was a nice campus, a state-of-the-art endoscopy unit. And now that I've been here 5 years, what's incredible is the commitment to taking care of patients in our community, as well as surrounding communities, because there are a lot of barriers, like Rob was saying, in going to Columbus, and a lot of the elderly patients don't like doing that. So to have those services available close to home does remove barriers. And our mission statement, which is to improve the health of the community, it's not just a mission statement. It really is truly how we do business. So it's great to be a part of a hospital such as us.
And it's a wonderful help for the people who live in Licking County.
Absolutely.
And where are we in gastroenterology as far as treatments and procedures, doctor? Is there a lot that you can offer to treat patients?
Absolutely.
A lot of answers.
A lot of answers. In fact, most of our patients have, because of our diet and lifestyle and the obesity epidemic that everybody keeps talking about, upper gastrointestinal issues such as gastroesophageal reflux disease. And a lot of us think of it as, well, it's a little bit of indigestion because I ate something wrong. But if you continue to have acid reflux, it may end up causing esophageal adenocarcinoma, which is life-threatening, obviously.
Well, we have a picture of something that you diagnosed called pill camera?
Yes. We do have a pill camera, and a pill cam is a really great technique. It's a little pill that has a camera within it, and you swallow it, and it takes pictures all throughout your gut. The battery life is about 8 hours, so you...
That's amazing. Wow. And Rob, as we're talking about all these things, if there is somewhere, especially around your campus community, how do people get in touch with you? Because they may feel intimidated and afraid.
Well, we've made a big commitment in our community with all of the family practice physicians to really encourage folks, if they're having issues, and even if it's just time for their regular screening test, to access our GI services through their primary care physician, but they certainly can call the hospital or access us online to see what services are available and what they may need.
That's great advice and easy access. Rob, thank you so much for being here. Dr. Karim, thank you so much as well.
Thank you.